Hi, I'm Dr. Mark Murphy, the lead faculty for clinical education here at ProSomnus Sleep Technologies, and we are so excited to be a gold sponsor of the EADSM this year. It's great. We're super stoked to be here. We already work with several international clinicians, including your own doctors Francesca Milano, Aditi Desai, Suresh Sharkandi, and several others. It's really a great opportunity for us to be here, and we are so proud to be a part of this very important sleep meeting. As a medical device manufacturer, and we're solely that, we make a couple of devices that are very advantaged for you. They're precision engineered, designed, and milled out of a control cured puck of PMMA, polymethyl methacrylate. That allows us to make them much smaller and stronger and lingualess, less advancement, easier to keep clean, all the advantages you'd like to have. The iterative advancement or IA device and the continuous advancement or CA device are the two shown here. Let me tell you a little bit about ProSomnus, the company, as well. We are really focused on a dentist-centric model, trying to help you be your best. Patient-centric designs that help you from a business model and perspective and help promote and engage physicians in prescribing oral appliance therapy today. It's kind of a unique story when I start to think about how we first came to design that IA or iterative advancement device. I remember, and I love to tell the story, our lead engineer who worked on the project, Dave Coons and Sung Kim, they came to me and showed me this very interesting device. And when they did, it was unlike anything else I'd ever seen. I noticed these 90-degree posts and I said, why are those posts 90 degrees instead of the normal 70-degree angle that we see on all the other dorsal type designs? And they said, that's what you asked for. I said, we didn't ask for that. They said, yes, you did. If you left them at 70 degrees when the patient's mouth opened, the mandible would retrude. And you said you wanted us to hold the patient's mandibular therapeutic position. As you can see here in this slide, at 90 degrees, it's always going to be in that same therapeutic position. But the moment we trade off the angulation to any other variation, you start to get some mandibular retrusion at various degrees of vertical separation. And that's what they were talking about. They were thinking of how the design would follow what we needed as clinicians. The other thing you can see in this slide are all the different kinds of iterative combinations that allow us to advance the mandible forward or backwards in unlimited length, actually. And all of the custom monogram features we have that allow us to create a patient-specific device. Not one size fits all, but each device clearly designable for the patient's phenotypic expression. So precision engineering, design, and manufacturing using CAD/CAM, that's not just milling or printing. It's actually taking it from your inputs as clinicians to design parameters that fit the patient in a very customized way and then allow us to create a precision oral appliance unlike any other you've seen out there. As you can see in this slide, the material is virtually impervious to staining or bioburden. It's just so much easier for the patient to keep clean. The devices are smaller. They allow us to create lingualist designs that are easier for the patient to wear. And as you can see, we start exactly where you've taken the bite relationship. Other devices can't level that kind of precision in their design characteristics. Similarly, when we advance the mandible, we can do so at a probably almost straight protrusion because we're able to modify both sides of the arches to accommodate any variation that you might see from right to left. And that helps mitigate some of the TMD side effects we'll see. Speaking of side effects, we get no tooth movement when we have this retainer-like fit of the control-cured milled PMMA. And when you have fewer side effects, you have better patient comfort, you're going to have fewer appointments, fewer adjustments, less breakage. And fewer adjustments, fewer appointments, that saves your patient time and it saves you time, and time is money. All of that creates a combination effort where the patient is so much more comfortable that their compliance and adherence is far better. And that adherence means we're going to also have better outcomes. And what better way to serve dental sleep medicine than to have an oral appliance therapy protocol that allows for better outcomes and better patient comfort. ProSomnus is dedicated to your success. We want the EADSM, we want all of Europe, all of the world to have the same advantaged precision control cured PMMA devices that we've been producing. It's an incredible opportunity for us. Thank you so much for letting us support the EADSM. We are proud to be a gold sponsor and we wish you the very best.